Assalamu alaikum. Welcome to our online session. I am Dr. Nafisa Rashid, Associate Professor and Head, Department of Pharmacology, Bashundhara Ad-din Medical College. Our today's topic is Routes of Drug Administration, Lecture 2. In my previous class, I have discussed about the sublingual route and the advantages of sublingual route. Now, I will start with the disadvantages of sublingual route. The disadvantages are the foul smelling or irritant drugs cannot be given, and water soluble drugs also cannot be given because water soluble drugs are not absorbed by this lingual vein. Only lipid soluble drugs can be absorbed by this route. And what will be the routes of water soluble drug? The IV routes are the actual route for water soluble drugs. Now, the examples are nitroglycerin in case of angina pectoris. Now, rectal route. It is an important route. The drugs are given parectally in case of unconscious patient, non-cooperative patient, in case of infant, in case of too much aged patient, we can choose this type of route. What are the advantages? It is suitable for extreme age. That means too much infant or too much aged patients are suitable for this route. It can avoid the gastric irritation. Irritant and foul smelling drug can be given by this type of route, and unconscious patient can be applicable by this route. Patient who cannot swallow are suitable for this route. Now, what are the disadvantages? It is a crude process. Patient may not like this process, may irritate the rectal mucosa, and fecal mass may inhibit it, and it cannot be given in case of diarrhea patient. The examples are Voltaren suppository, that is used for severe pain after surgery, purgatives for clearing the bowel, and enema also. And paracetamol suppository for reducing the fever, or in case of febrile convulsion, the infants are given by this route. Now, systemic route. Systemic routes means subcutaneous route, intravenous route, intramuscular route, etc. Subcutaneous route means the drugs is given beneath the skin, just under the skin in the subcutaneous area. This is a less vascular area, and we know that the area that is less vascular cannot spread the drug easily. It can slow and sustain action. Such advantages are foul smelling irritant drug can be given, and the drugs if we need the slow and sustained action like insulin, this type of route is chosen for the treatment, and self medication is possible. You have seen that the diabetic patient takes his insulin by himself or herself. What are the disadvantages? It is painful. It is large volume drug cannot be given. The special apparatus is needed, and discoloration of the skin, that is lipoatrophy, may occur. What are the examples? These are the insulin, adrenaline, etc. Now, intramuscular route. Intramuscular route, you know that the vaccines like corona vaccines, etc. are given in this route. The sites are deltoid muscle and gluteus maximus muscle, upper and outer quadrant, and deltoid muscle, it is lower 1/3. What are the advantages? Reliable, suitable for irritant drug. It is rapid onset of action, but then subcutaneous, but not as rapid as intravenous route. Moderate volume of drug can be given, and sustained and prolonged action. Disadvantage: this is painful route, expensive because some apparatus are needed for the administration of the drug. Self medication is not possible and may cause tissue damage or hematoma. The drugs are benzyl penicillin, pethidine, streptomycin, diclofenac, etc. are given through this route. Now, intravenous route, the most emergency route that are used in the hospital. Drugs are administered into the vein in bolus form or through infusion. What are the advantages? It is a rapid onset of action, 100% viability due to bypass the fast metabolism. When we give the drug, at once the drug enters into the blood. So, there is 100% viability and 100% acute condition we can use. Large volume of drug can be given to the unconscious patient, and water soluble irritant drug can be given also. Now, what are the disadvantages? The disadvantages are strict aseptic precaution is needed, self-medication is not possible, it is expensive because special apparatus are needed, chances of complication like thrombus formation, embolism, air embolism, etc. may occur. Ambulatory patient cannot take it and skilled hand is needed. We know that the nurse or paramedics can give this type of route, drugs in intravenous route. What are the example? IV saline, heparin, thiopental sodium, etc. given through this route. Now, intrathecal route. Intrathecal route means the drugs are given into the spinal route, and spinal anesthetics drugs are given by this route. Antimicrobial agent for cerebral meningitis, this type of route can be chosen, and in case of acute and chronic intractable pain, intrathecal route is chosen for giving the analgesic drug. Intraperitoneal route, that means the drugs are given into the peritoneum, and hypertonic solution like hypertonic solution for dialysis in the patient of chronic renal failure, this type of drug is given. Now, intra-articular route means that in joint this type of drugs is given like corticosteroid for the rheumatoid arthritis and opioids for the joint pain. And intra-arterial route, we know that intravenous route is more common than intra-arterial route, because intravenous route there is no fluctuation of the speed of the blood, but intra-arterial route there is all time the blood is moving very speedily, and so this type of route is not easily chosen, but anti-cancer drug or vasodilator drug are given in the intra-arterial route. Now, intracardiac route, like in case of cardiac arrest, adrenaline is given in case of by intracardiac route. And intradermal route, some vaccines are given by intradermal route, it is between the dermis and epidermis. And transdermal delivery system, it is the system release the drug through a rate controlling membrane into the skin and go into the systemic circulation. It is a patch type formulation in which the drug is released sustainedly and enters into the systemic circulation. Advantage, avoid the fluctuation of the plasma concentration, and disadvantages, so it may cause accidental poisoning, and the examples are glyceryl trinitrate, postmenopausal women in case of hormone replacement therapy. So, these are the important routes for intravenous. Now, inhalational route, as gaseous volatile anesthetics drugs are given in this inhalational route, and aerosol like salbutamol, steroids, etc. are given, and as a powder sodium chromoglycate is given. Advantages are rapid uptake and rapid elimination of the drug. Self-administration is possible, no systemic effect, but disadvantage is special apparatus is needed. These are the important routes by which we administer the drug, and remember the point very carefully. It is very important for your written and also viva question, and you have to give direction to the nurse in case of hospitals. So we have to learn it very much carefully, that which route we should choose in case of drug administration. So best of luck. Thank you. Allah Hafiz.